This is the Stay Healthy Experience, hosted by Robert Ferguson, Mr. Daniel Baldwin, and Barbara Kris. And today we're going to have a candid conversation about the coronavirus, and we're going to talk about it in a way that I think is unique. And a lot of people aren't talking about this, and that is how it's impacting poor people, if you will, brown, black, families where there's quite a few people living in the same home. And at the same time, establishments like prisons, jails, what is that like? And so we've been fortunate enough to have a guest. Mr. Daniel Baldwin, would you please introduce your friend, Sargent Jon?
With us today, a close family friend and civil servant in Onondaga County, Sargent Jon Seeber. John, welcome to the show.
Thank you.
So what is it like, John, right now? Is everything the same? Do they have everybody to stay in their jail cell? How's that working out?
Yeah, we had to come up with some major changes, not only on the road, but like you said, in the jail and the justice center and the prison that we have. First and more, we have stopped all roll calls where the deputies and the officers would get together in a room before their shift to discuss things that happened on the previous shifts or things they need to know about before they go out on the road or whatever. So we've kind of separated the social distancing. So we're holding our roll calls either by email, video, or like out in a parking garage area where people can be 6 feet apart to do that. We've been all issued PPEs. That's a huge thing because there's, a big demand for them right now. So, we obviously are doing anything we can to get our hands on them. Even locally here, American High Production, I was fortunate to go out there and pick up some from them. I'm actually going to go out there this week and actually participate in producing them. So.
Wow. So it starts from the outside in, right? So you have, fellow, I guess law enforcement personnel shows up. There's a whole damage control there. But what's taking place as far as like inside with the prisoners? How are they coping?
Well, we're fortunate to have a cell system where they have their own cells, so they're not bunking together in a sense. So it's called like a housing unit, or say, and so it's nice. So there's that one-on-one. So they're separated that way, and it's really just limiting the people that come in to visit, recreation time, all these things, just like everybody else. We have to stay in our house. We're kind of on a lockdown situation at that point too. So,
but how does that work when you want to take a shower? Like, how does the showering work? You know what I mean? Like,
there's separate showers, so they all have. Again, it's no different from before. They take their turns, and they have a shower stall, just like a bathroom would. It's not open up. I mean, a lot of people perceive prison as a cell room with 2 bunks and a toilet, and that's not the case here. It's 1 bunk and a toilet and a desk, so they all have like their individual pod.
Man, this is a nice prison.
Yeah.
Hey, John. So something comes to mind to me. So under normal conditions before the coronavirus, you would get together for this roll call. You would sit down. You would review things that happened in the previous shift. I guess there would probably be some types of directives of what you're looking to accomplish and goals and so on and so forth. You're not doing that now. So with the coronavirus, would you say not having that normalcy in those types of pre-shift meetings, does that affect your ability to be totally effective in law enforcement?
No, it doesn't. Again, anything that can be relayed person to person, we can do it via email before their shifts, or like I said, we've opened it up where, for instance, a night shift utilizes the Sally port when you drive into the jail. So there's 2 garage doors on each end, and it's big enough in there where they're able to spread out, and the supervisor can do the roll call there, make sure everybody's, in their inspection and they look good and whatnot before they go on out into their pods. But I mean, it's just a different way to adapt, I guess. I mean, we're still doing what we can and what we used to do. We're just doing a little differently.
How about the interaction with the citizens for the basic, patrol officer?
Yeah, again, those are some changes we had to do. Hang on a second here. I just lost you. Or something happened here.
You're on. I can see
We
you.
got you. We
I don't know
got
if
you.
my battery's going low or something happened, but there's a screening type service. So when somebody calls 911 and they want the police to come, the 911 dispatcher is asking certain questions if anybody's sick, ill in the house, things like that. So if there is, we can, or the deputy's nervous about going into the house, they can ask the person to step out of the house to conduct the business, unless it's like a domestic situation where we have to go in and intervene. And then we have, like, we call priority 1, 2, and 3 calls, and the priority 3 calls are the calls that are non-emergency type of incidents, or that they're invest calls of something that's already occurred. So we've kind of made it available on our website that we have a non-emergency police report, so people can go online and fill out. So say your car was entered in the middle of the night and some things were missing. Instead of calling us and having a patrol unit come over, you could go online and just send the information in, and we can conduct a follow-up investigation, or somebody that's inside the office will call you and try to further that investigation at that point. So there are different things that, again, we don't have other officers ride with officers in the cars. It's 1 per car. We still have to, do the social distancing as well. So.
Yeah, I was just about to ask that with how you partner up, because there's been a few times too where I'm driving and you see a police officer who's pulled someone over, and they might have their partner, but they're like standing like way far, like way behind. I mean, how does that impact your ability to do your job safely?
Yeah. So again, we're issued the PPEs. So we have our masks, we have our gloves, and we're doing, like I said, everything we can to eliminate it. So, we don't allow any of our officers to ride with another officer. So we have no double units. If worst case scenario, again, we would suit up, with our mask and our gloves if we had to do that, but that would just be like if we had to bring one of our cars to the garage for it to be repaired, so we have to drop it off and we need to ride back to the station, so that would be the only circumstances that would occur.
All right, I have a hypothetical for you. So one of the things that a lot of people aren't talking about, and I can't wait to get the perspective from Barbara and Daniel on this as well, is in California, there's quite a few families where, let's say there's a 2 or 3 bedroom house and there's not 4 people in the house. There's 12, 13, 14 people living in this one house. And the thought of one person attracting the virus and living in that house, it's just a matter of time before someone gets really ill, and probably more than half the people in the house have the virus. That's going to happen. It's probably happening right now when you have everybody living in the same house. How are you guys going to deal with that? Because that's going to be a combination of the hospitals working with law enforcement to go inside and keep everybody else quarantined. You know what I mean? You guys see where I'm going with this?
Yeah, and it's kind of like what we're dealing with now. I mean, we have family members. I live in a household of 3 other individuals. So if one gets it, more than likely I'm going to get it, and my daughter's going to get it, or my son. But it's just the fact that what they're trying to do is they don't want individuals going from that household out to the public for unnecessary reasons, and then contracting or possibly exposing other people and then coming back to that resident. So it is tough. There is, I guess, no real way to control that, because the only way you can do it is by just staying in your house. And again, if you have the virus, you're more than likely it's going to spread throughout the family. And that's what we're seeing. A lot of our numbers here anyways are, we'll have one person that's test positive, and then you'll find out like 3 more people are test positive. It's part of that family. So it's happening. And, the numbers are going up every day here. I think it went up another, 14, I think yesterday or something. So, and just in this county.
It's going to continue to escalate, because if you are to follow the actual definition of quarantining, then you would know that you are supposed to. I wrote this on my WordPress 3 weeks ago. This disease, this virus you can only get it if you invite it. It has to be invited. If you are truly quarantining, then you don't have a chance of getting it because it's not in your house. So if you're truly quarantining. So I believe the answer, Robert, particularly with high volume households, I call them. So if you're in a 4-bedroom home with 12 people in it, the mathematics would support, on average, it's 3 people per room. If someone contracts elderly grandma or whatever, goes out to get her physical therapy and comes back in, you're going to have 11 people in 3 rooms and grandma in her 1 room. Is the reality of that. You try to quarantine within the quarantine your grandmother. But again, it would be so mind-boggling hard to go in there with masks on and service what grandma needs, and to not expose the other people in the home. So, the real answer to it is stay home right now. Stay home. Don't invite people.
And that's what you say. You got to isolate that person. It's going to be so hard, especially in a house like that, because you really want to make sure they have their own bathroom, their own bedroom. That's where they stay.
Volume just got crazy.
Yeah, we're getting crazy feedback there. If someone, because sometimes if you're on a device that's capturing the same thing, it can do that.
Mm.
So, John, are you on Facebook right now?
No.
Okay. Anyone?
John's volume just got like, I don't know, something's too close to your mic or something's going on, John. Talk again.
Can you hear me now?
Yeah.
Good.
I got too close.
It's really low.
I don't know.
Can you hear him okay?
I hear him.
It was a little low.
He's going to project more. He's an opera singer.
I have a kind of along those lines, though. I was wondering with some of these communities that maybe, just don't have as many resources available to them, or they don't have, not everybody has Wi-Fi or whatever it may be. Do you feel like the information is getting across, into those neighborhoods relatively evenly? Because it seems like, for a lot of us, we have an overload of information.
No, Barbara, no. If you go on Facebook, John, I'm seeing families and people who are aware and knowledgeable taking their cameras and videotaping guys playing basketball, full 5-on-5 games with people on the side, high-fiving, belly, chest bumping. Is the law enforcement going to pull these guys over and say you cannot do that anymore?
Yeah, we've been doing that. Actually, here in Syracuse, they've at the parks they took down the basketball hoops. In the meantime, we have an order now to shelter in place. But again, we've been responding to those type of calls probably since the 26th of March is when our county executive put out an order, and we started receiving phone calls to 911 center, and they're coded as a local law call. So anytime, but what we're finding out is that a lot of these calls that we're going to are juveniles playing with their friends, playing basketball. So it's important that we get the message across to the parents of these kids, because they're young. They don't understand this. My son, myself, he wants to go out and play basketball with his friend across the street that he's done every day of the summer last year. And now he can't, he can just look out the window and see him, and it's discouraging for him, but he's, I'm trying to explain to him and have him understand how serious this is, and that's what the problem is that these parents are just allowing their kids to go out, and next thing you know, they're playing football, basketball,
Right. Or they're working. Maybe there are some of the few that are still working. They can't, manage their kids that are home. And because I see some of that too. I see, groups of kids, relatively young teenagers on their bikes. They don't look like they're part of the same family, and they're just kind of hanging out.
Yeah. You're not, what it's called, and Barbara and Robert and I probably more than John will understand this analogy. You're not seeing the flames yet. You're not feeling the heat yet. So when Simi Valley is burning up with one of the worst forest fires, and we're watching it all, and we can see the smoke a little bit, and we hear about all the houses, but it's not until it's in Woodland Hills or it's in Malibu or whatever, and you go, hey man, they are making us leave our house right now because we are in that kind of I can feel the heat from the wind of the fires coming. It's 6 blocks away and 800 homes. You're not seeing the flames yet in America yet. In some places in New York City, you're seeing the flames now. And in California, as I spoke with Robert and John Collins from Stay Healthy and a couple of people, well, they're thinking of relaxing the restrictions soon. Go ahead and do that. Go ahead and do that. And watch, the wind will pick up. It'll fan it again. You need to stay home. This is going to be 6-8 more weeks, for sure, before you're really going to get on top of the curve. Because remember, just like that fire, when the wind picks up and the numbers increase, and they're going to increase because you're not testing, you're not getting enough numbers. There's a lot of people that have this that don't know they have it right now. So when it blows up in the next, I predict 2 to 3 weeks, and we peak at the top of the numbers, then suddenly you're going to go, oh my God, my cousin has it. My next door neighbor has it. 2 people at work have it. It's going to get closer to you. You're going to see the glow of the fire as it's starting to move towards your home. And then you're going to understand, hey, maybe I should really just stay in right now. Then we'll really jump on top and we'll lower the curve. But that hasn't happened yet. Because if you look at what people are doing socializing wise, there's people right now down at Walmart with no masks on, no gloves on, walking around that store, touching an item, putting it down, coughing, sneezing. They don't know. They don't know. Do you know what the biggest transference in Italy they traced in northern Italy? Do you know what it was?
What?
Gas station pumps.
Yeah.
Gas station pumps. People are coughing in their hand. They're outside. It's still cold. They grab the pump. The next guy goes over. He gets coronavirus. He pushes the pad to put his credit card in. He gets coronavirus. They were giving it to each other at the pumps left and right. Do you see people pumping their gas right now with gloves on? No.
I can feel the heat.
I do.
I can feel the heat.
You know
what? Go ahead, Barbara.
No, I was just gonna say that along those lines, Daniel, and I totally agree with that. It seems like they need to be sharing, which is great why you're here, John, too, is the stories of the people who are actually on the front lines, the healthcare providers, the first responders, and everything that they're dealing with. Those of us that don't see that, like you said, Daniel, it's like we haven't felt the heat yet, but when you see what they're actually dealing with, like literally looks like a war zone. It's unreal, the severity of what's being dealt with. That seems to be, you'd think would be more compelling for people to see that.
Well, so here's what happens, and I don't know, but I suspect in New York you may see this. Pardon me?
No, go ahead.
What was the
hating on me? He's hating on me as usual.
No, I said, go ahead, Daniel. Finish your point, sir.
It's like 5th grade. He's like that kid in the back of the classroom that had to say something. I think you'll see an implementation. I'll go ahead and gamble and say that on the outskirts of Manhattan and certain places, you'll see a military presence. And so you say that, and people go, you mean they're going to enforce some kind of martial law, some kind of curfew? If you can't get the people, so think about this for a minute. You are somebody that lives in an apartment, and your mother lives in an apartment, and she's a couple blocks away. You're going to have to go out. She does not have the freezer capability and the food and so on. You're going to have to go out and get her medication. There are some necessities. If you're going to go out, you want to minimize that contact, that exposure. You don't want clowns that are all over the place that just don't care about. So you may see in densely populated areas a presence of National Guard in the next few weeks. You might, because you have to. In Italy right now, you walk the streets and military men walk up to you armed with guns and say, where are your papers? Where are you going? What's your job? And you got to prove to them that you're on your way as an EMS worker or as a nurse or whatever, or you can be arrested and detained.
Yeah.
And the reason why they did that is because you can't get the average person who's infecting the actual guy going to get the medication because he's not being responsible about it. So if you're not going to get everyone to buy into it, you're going to force them to buy into it. And I think you might see that in New York. New York's ground zero right now.
Yeah.
Well, I have a question for Sargent Jon. I was looking at some data the other day, And the data said that in stores, liquor stores, sales are up about a little over 50%. Alcohol online is up 250 something percent. I know that when people spend more time with each other than they're used to, and the fact that they are starting to drink not at 5 o'clock, but starting around 11 o'clock, that domestic violence must be up.
It is.
Talk about that.
Yeah, we have seen an increase. And again, it's a part of this whole pandemic that you're going to see this. People are together now. They're longer hours of the day together. So we definitely have seen an increase. But there's certain crimes that we've seen in a decrease. We don't have a lot of traffic out there, so we're not seeing a lot of arrests relative to traffic offense type incidents. You have less people congregating together, so you're not seeing as many harassments, assaults. But like I said, what you are seeing is the domestic incidents, verbal, physical, they have come up just in the, we did a comparison from last year to this year, just from March 1st to April 1st. And I think it was like a 10%. We're up 10%.
I see that going up.
So here's another one for you to contemplate.
Cool.
Are you aware of future projections that are going on right now that they're speculating record since the 1960s? They are projecting that in January, February, March, April, and May of next year, there could be an additional 20% birth rate for the number of people that are home right now that are just shagging because they're home with their partner and they're normally not. So you got nothing to do. Guess what? Bump up the volume, bump up the volume, bump up the volume, dance. People are doing it. And they're looking at being locked in for the next 3 months. And how many babies are going to be born as a result? An influx that hospitals will not be able to take care of. Gynecologists are going to be flooded with millions of extra children that will be born next year. And they're talking about it now. They're saying it's going to happen.
Yeah.
Well, there's a lot of Barry White being played tonight. If I don't beat you, we gotta do something else.
Wow, you
It's messed up.
He lost it, didn't he?
I have totally lost it. There's something about being in this moment and not being able to just go outside and run and walk. Because we're seeing that more people are gaining weight also than they are at staying at the same weight or losing weight. And we also saw in the reports that more people are purchasing processed foods. And I see this whenever I go to the store, because I go probably twice a week and I get fresh fruits and vegetables. They're always there.
Yeah.
You go down the aisle looking for some Oreos because you're craving. Who got the Oreos, man?
Yeah, I learned that when I lost this significant amount of weight with diet-free life. I learned the key to it. If you just don't bring it in the house, you can't eat it. And that's the key for me. I don't play this anymore. I have the stuff because my kids need it or whatever. I don't want my kids to eat it either. Diabetes is in my family. Weight gain and obesity is in my family. I don't want to introduce that to my kids. So I'm not saying either that I'm the Grinch that stole Christmas. I don't have some stuff every once in a while, but I very limit it. I limit it greatly now. That's the answer, Robert.
Well, thank you, sir. So John, do you guys have much concern, or have you had briefings on the potential outbreak of people vandalizing, breaking into Walmarts and breaking into, fitness centers? You know what I mean? Like
breaking into businesses because they're not occupied and open.
Yeah. So that's one of the things. It's a part of our proactive policing. We have to, do a lot more property checks, business checks, which again, we still have a call volume, but it has gone down. People, I think, get the picture and they know that, they don't call the police for it's really not necessary for some of the things that we were getting calls for, if it's a barking dog or this, stuff to tie us up. We're not responding to those anymore. We're not seeing the calls coming in like that. So it allows us to, get to those businesses and check them at night, during the day, the ones that are closed up. So, but I think, like you said, I think really the big picture, what we're going to see is that rise in the domestic violence calls. That's just going to be a given. I see videos and stuff now. One was, there's a caption like, your blinking's bothering me, stop, like, I just think being in close quarters for such a long time, eventually, people are going to get irritated with each other and discouraged and upset and, anxious to get out of the house, and, arguments are going to happen. So,
are you ready for this Sunday? Because I would be willing to bet somewhere there's going to be some pastor that's going to say, we're having church. And there's going to be a lot of members going, we're in God's hands. Would you guys shut that down? Like, what would happen if that were to take place?
Yeah, we're forced to shut it down. And these things are getting referred to the Attorney General's office, for further actions. Especially like Daniel was talking about, some of the bars, establishments, they're being shut down and it referred to the AG's office, and some establishments are losing their liquor license over it. So again, they're looking at it, this is my livelihood, I got to pay, I got to, support my family, and we're looking at it as a public health crisis. And, it's unfortunate, but in the long run, you shut yourself down for a little bit, and the sooner we get this thing passes, the sooner you can get that establishment back open. And, versus trying to get your license back, your liquor license is going to be much harder.
Yeah.
Oh, go ahead, Bob. Go.
You're just a quick question. Thanks, Daniel. With respect to like the holidays, are there any, hints of the fact that maybe people wanting to visit their family that are in prison or incarcerated, that they're going to cut that off just to limit outside exposure? Or
we already have done that. We don't have open public visitors. We're doing things, we're allowing inmates free video conference calls and free phone calls, so they have that option. So, which is kind of nice that we've been able to do that for them. So nobody's coming in and out of the facilities.
Okay.
Hey, so I got, two thoughts. One, as we kidded before we started the show about how Robert and I do, we have movie nights with our girls. I realized that going to a service for Easter is, part of the game plan and the tradition for many families out there. But the idea of, whoever it is, if it's, Joel Osteen or whoever it is on your big screen at home and televising that and praying and recognizing Christ or whatever it is that you believe in, Passover, as a family in your home, is where we're at this weekend. And so, it's the best you can do. It's the most responsible thing to do. And it's still available to you via satellite or cable or whatever it's going to be. So it's not like we have to go without, it's just an adjustment we need to make this particular Easter weekend.
Well, hey, I already put the goat blood on my front door. I'm good, baby.
You good, bro? It's like doing a show with the Black Rodney Dangerfield right now. It's like, hey, I'll tell you, all right. The other thing I wanted to ask from a law enforcement thing was to John, and that's, hey, John, how does this affect prostitution, and how does this affect homelessness? Have you seen a change in that? Oh no. You go.
Hey, Daniel.
That's so funny. Hi, Beth. So John, the homeless, community, That's got to be really, trying, for law enforcement right now during this. How's it? Any notes or any insight on that?
No, I mean, we work closely with the rescue mission. So they're still in operation, and they're able to house these individuals, the YMCA, things like that. So there are facilities out there. Our county exec has pushed out a lot of services that are offered to the community, even daycare for the essential employees that have to go to work. They've made some adjustments. So out in the county wise, I mean, the prostitution, that we would see would typically be like, the back page type ad stuff, where it would involve usually a hotel room. And as you know, not too many people are staying at the hotels nowadays anyway. So,
Yeah, that's true.
but,
So you've seen it lowered then. You've seen the problem lowered, dude.
Yeah, we've had to make some adjustments on our end too. So we have certain detectives that are assigned to special investigations units, and again, a lot of this activity is slowed down because of this. So I'm sure, I can't speak for a prostitute, but I'm sure that they probably have some concerns about going and staying at a room, or being around somebody that could be infected that way, an easier way to get the virus.
So John,
Robert, did you want to jump in now?
no, I'll think about something. And I think a lot of that, it would work the same as dating. Dating is down. Getting to know someone is up, right? Because of Zoom and FaceTime. But my question right now is, knowing that a person has a coronavirus, right? So let's say that someone tests positive and they decide they're going to go and infect some people and just not even let them know. Maybe it's a date. Maybe they meet, you know what I mean? Like, so if you knowingly have the virus, but go and improvise someone else's life, could a person go to jail for that?
Yeah, we've had it happen here in our area where you're seeing individuals go into stores and attempting to steal things, and they get caught. They're claiming they tested positive, and they're starting to cough and spit, and so they're being arrested, even if they're not positive. So if there's a way to determine that somebody knowingly is doing this, they're going to get arrested and charged.
Wow! So someone could literally go in and try to steal some Oreo cookies, get caught, and go, "Hey man, back up, back up."
If they start saying, "I tested positive, I got COVID-19," and they can get arrested.
Well, that's very similar, guys, to when we had the big blow up with AIDS, and then you had people that were on dating sites knowing that they were HIV positive, having unprotected sex with partners without informing them that they had AIDS, and they were arrested for attempted murder.
Wow.
Prosecuted.
Yeah. I just saw an article, I think it was a day or two ago, of a woman in California was arrested for that. Well, for purposely going into a store and like licking and touching stuff, and just crazy.
Yeah.
So what would you like us to like? I guess, John, what can we do as citizens? Like, what do you want people to do more of that that they're not? Because a lot of people will watch this and it's like, okay, well, tell us what we can do that make your life in law enforcement easier.
Again, I think the biggest thing that we have to do is educate our young children, our young kids about this virus and how serious it is, and how serious it is to have that distance with their friends, because like we discussed before, some of their parents may be essential workers, some may just not care and say, yeah, go outside, play with your friends. The next thing you know, there's 6 of them playing ball, like rubbing chests together, tackling each other, touching the basketballs, passing it back and forth. So that's one of the huge things that we look at is just the educational portion of it, and just trying to get people to understand how serious this is. And, stay inside, stay home, and, like I said, limit your time out. And if you have to go out, make sure it's essential that, you have to go to the grocery store for some particular food, but if it's something that's not necessary, we shouldn't see you at Target looking at clothes. And, you should be getting your essential things that you need to survive right now.
All right. So big question for you and Daniel as it pertains to the state of New York. When is the governor going to shut down the subways?
Well, so, it's interesting. I've watched a lot of criticism of the current administration and the president that he's pulling money, federal funding for testing, and he's going to limit the capability of testing. And so when I see that, I wonder whether or not it's because the state of New York and the administration and the American people don't really want to know. Do you really want to know? Do you really want to know how many people have it? Do you really want to know how dangerous this is? This is this game that goes on back and forth in the popularity contest in an election year. So, I don't know. I think the most fascinating thing is the wide array, the polar opposite opinions that can come up on something that should be so simple to understand. There's only one way to flatten the curve and not get this virus, and that's not be exposed to it. That's a no-brainer. Now, if it was leprosy and you went out there and you started seeing neighbors' arms falling off and people dropping in the street, decaying and dying, you probably believe it more. It's the same as the drug addictions work that I do. And John will tell you about this because he sees it on the front lines. I would be willing to bet that 85% or more of any violent crime that's done in Syracuse, New York, has some undertone or overtone of drug addiction or drugs involved in the crime. John?
Oh yeah, absolutely. And we've talked about this on several occasions, and, we have a heroin issue in this county, and, nothing ever good comes out of heroin. So it's either death, jail, one of the two.
So with that said, knowing that the number is that high, you would think that as a society, we would want to jump on the core to what's causing all these other crimes. Prostitutes are prostituting to supply their habit. People are stealing, people are shooting, people are robbing, people are influencing, they're raping, they're crashing their car. So much of it has to do with that root problem. Wouldn't you think the focus would be that problem? But it's not. It's not. We're not attacking it. We're not doing anything. The same's going to happen here. So to answer your question, now that I'm going to round the wagons, I'm sorry it took so long, about until you see people getting really, really sick, not 700. I told you, there's a Joe Rogan has a guy on the CDC in a podcast. It's absolutely mind-boggling. And he said, he predicted, they knew ahead of time, a month ago, more, when I was telling you, Robert, get ready. It's coming. It's going to be way worse than people are telling you. It's going to be really, really bad. We haven't gotten there yet. We have not gotten there yet. It's not when it goes 40, 80, 160, 320, 6, that's not when it goes. It's when it goes 1 million, 2 million, 4 million, 8 million. And I'm talking each day it can multiply by 2. So when we get to 16, 32, 64 million nationally, then you're going to see the subways close. Then you're going to see everyone go, I don't care what, because the shift will change. The American people will say, shut it down. My mother's dead. I got a friend, captain of my football team. His mother's dead. Coronavirus. Vivacious, 80-something years old. One whiff of it, gone. My friend Tom Wachowski, great guy, law enforcement guy down in the Carolinas, lost his mom. I wrote to him, I'm so sorry to hear about your mom, Tom. I'm praying for you and her. He wrote back, this coronavirus is really serious, Daniel. It's really serious. We have not seen it yet. We haven't forced them to tell people who to shut down a major mass transit system. We haven't given them enough.
Daniel, what are you guys? I mean, your mom, is up there in age.
Yeah.
Right. And so, yeah. So what are you guys doing, or what have you done, or Beth, to help?
So we literally have, screened carefully her 2 nurses and said, what are you doing when you leave? Or, so they're taking we've made sure people have masks and gloves and so on. And they go straight from work in their car to my mother, back home and home with their family. They're not out, they're not doing anything. And we've said, listen, if you can't follow that criteria, if for some reason it's just, you got another job, whatever, you need to let us know because you're not coming into the house anymore. Because my mother gets one whiff of it, she's gone.
Right.
For sure. So, but she has two nurses and my sister Beth, and her husband Charlie are in the house with my mother. So my mother, is my mother, ironically, only doesn't know any different. She doesn't really come out of the basement much. She's not that mobile. So she just goes, "When are you coming over, honey?" And we call her on the phone and FaceTime her, So we're not seeing her physically, but no one's around my mom, just her two nurses that she has. She has nurses, 16 hours a day.
Nice.
So yeah, and we've been blessed to be in a situation that we can afford to do that for her. And my sister Beth, poor Beth, has the night shift where, mom decides she wants to get up and go to the bathroom at 2:00 in the morning. Beth has to get up from the second floor and go all the way to the basement, take my mom in. And my mom's notorious for driving Beth crazy. But I don't think that's the example. I think the example is more what you were going at in the very beginning of this broadcast. And that is, what do you do with people who have not convinced themselves that this is that dangerous and are still working? I was on the phone with Robin, and she had the roofers are up doing the roof. Now that's an outside job, but then they came to the door and I went, you can't exchange paper and sign things. You can't expose yourself to this. Do you not understand that you can take a pen out of someone's hand and get coronavirus? You can go to the supermarket. If you don't have gloves on, when you go to push that keypad, that keypad has been touched all day long at Walmart by 500 people. 500 people. Did any of those 500 people and the 20 people that they saw that day, that's now 20 times 500 has touched that keypad. That's how you have to look at it. So if you're going in there and you don't have a mask on and you don't have gloves on, you are out of your mind. You're out of your mind. And you're bringing it into your home and introducing it to your children, your elderly parents, and anybody else, your spouse, anyone else in that home. The minute you touch that keypad, the minute you pump that gas, every single person that's touched it for 12 hours is now in your life. Bing.
Thanks for brightening our day, Daniel.
But there's a way. Again, it's a very simple remedy. It's a very simple. Wear the gloves, wear the mask, protect yourself, and stay home.
Nice.
Right? Yeah, I predict she shuts down the subway. You'll see the spike within 10 days. It'll be millions of people in the United States will have it in 2 weeks.
Yeah.
So John, I just got to ask about, because there's so much stress dealing with all of this, but I can't imagine the stress, as a police officer or a healthcare provider, what kind of stress levels you guys are all dealing with, and what is being done to help, deal with that.
So we do have peer-to-peer available for our people. But again, it's just a situation that we are adapting to, and it is crazy because it's an invisible virus. You can't see it, and you just never know where it is. And it's we're always on the precautionary type side of things anyway. So I think our people are doing really well with that, as far as making sure that they keep their distance, have their PPEs available, hand sanitizer. We've, issued to everyone hand sanitizer from my unit itself to the entire agency. Everybody has masks available to them and issued one. So it's a scary time right now. And, we're just dealing with it as best we can.
Have you had any cases? Are you allowed to say, John, have you had any cases within the department?
We are fortunate. We have not had any. So
wow, that's great.
We're very fortunate for that. So,
and you're taking those major precautionary measures. That's what I'm talking about, Robert. I mean, I don't want to be the voice of that. I'm trying to educate people and trying to help them to avoid getting this. There are people that are going to have to go out. There are people, but you need to take every precaution if you're out there. You do.
Yeah. I mean, we, right from the get-go, I think I talked to you right in the beginning of this, and, we had shut our office right down completely to the public. We weren't allowing people to come in to do fingerprinting, ID cards, any of that stuff. We shut it right down. And most of our staff is civilian employees in that area. So, they're non-essential. So we sent them home. So it's, we're operating as best we can as well. We've had to shut things down, and certainly we didn't make, we upset some people. The biggest thing is pistol license. You know, we're still processing the applications that we had, but we're just not taking any more in because, like you said, it's on the paper. You know, it's, you know, allowing people to walk in the office, everything, those type of things can't be done by mail. You know, everything has to be done in person. We have to set up appointments, you know, photographs have to be taken, paperwork has to be signed in front of us, all that stuff. So,
Wow. So in the medical world, something we've been aware of, like telehealth, we know it's powerful. We know how it can help companies save money. And it's been around for a while, but now people have become knowledgeable of how to use it. So my thoughts are, it only makes sense that there would be almost like telecop or law enforcement, or where I can go on my phone and instantly be in touch with someone in law enforcement, which I could then show, you know, video, or, you know what I mean? Do you guys have that? Is that something that's currently being used?
no, I mean, there are, you know, some social media sites that we operate off of, like Neighbors app is one. We're able to get a message out to the public. We can do it by certain areas. So I can send out a mass statement, or if, you know, say there was a crime in your neighborhood and we're looking for video surveillance of some sort, we can send out a message to that particular area. You know, like I said, we went to a non-emergency police report that's available online for people to do and send in to us. We still have our 911 system here. So we tell everybody, for whatever reason, all police services, fire, EMS, everything goes through 911, whether it's an emergency or non-emergency. And, you know, if it's a non-emergency call, that dispatcher or the supervisor will reach out to a patrol supervisor and discuss the circumstances of the call. And we can do things by phone. Like I said, there are some things that obviously we can't do by phone, but there isn't, I don't think that you're going to see any virtual phone police. You know, like, you're not going to call me and I'm not going to be on FaceTime with you and, you know, take a complaint from me. I don't think I'll see that happening.
Yeah, I can see. I mean, that can come in handy, you know, especially for domestic violence situations, you know.
Yeah.
Like, you know, look, he's, you know. Well, you guys, so let's do a round table as we have like less than 5 minutes to wrap this up. And we're very thankful, John, that you made time to do this.
Oh, I appreciate Daniel.
Barbara, do you have like something inside you that you're like, I got to ask Sargent Jon this one question?
No, I mean, I think he did a really good job of just sharing their, I guess, their perspective. I guess, if anything, and I mean, Robert, you kind of touched on it too, as far as what, John, that you'd want to share with the public, as far as the top thing you'd want to have the public know and maybe do to help out.
Yeah, I think it's just very important to listen to your county officials, your state officials, just, you know, to tell you to stay in, and they're trying to starve this virus. That's the most important thing, is just obey by it. And, you know, it's the only way we're going to get through this.
All right, Daniel.
Well, I would have two things to say. The first one would be in relation to what Barbara and John just talked about, and that is, you know, when you're watching TV late at night and they bring up the sick puppy, and there's Sarah McLachlan speaking for, you know, the ASPCA, and these dogs only need $4.99, and you can save, and you think to yourself, man, I want to make that call, or man, that's terrible. I want to help that, or I want to help this cause, or whatever, or a kid that need, you know, at St. Jude's, whatever, and they tug at your heartstrings. And then some people, you know, who are in the position to do it, you are in that position right now. You are in that position during a virus that is killing a lot of people around the globe. Just what John said, stay home. Don't expose yourself. Don't expose others. Use the social distancing, use the masks, use the gloves. Only go when you have to. Don't call 911 over stupid stuff and tie up the police. You shouldn't do that anyway. But especially right now, be conscious of what you're being directed to do and do it. And that is your contribution that you've always wanted to make. You can do it. Just follow the directions. The number two thing that I would say to sum up what I feel is, I look at every single thing in my life. I look at everything. I look at this situation and I say, what is my opportunity? What is my opportunity in this situation? And there is an opportunity for me to spend more one-on-one time with my kids, to cook meals, healthy meals, and sit with them, to pray with them, to talk to God more. I'm doing things, just silly stuff around the house. How many times I've walked on that side section next to the triple garage and gone, man, I got to clean all that crap up. I really want to get all that stuff. There's nothing stopping me now. There's nothing but things to do, honey-do list and little projects and stuff to do, that you're never going to have this kind of time when we reset everything. We're going through a reset. We're going through a reset right now. Take advantage of it. Speak to your kids. Watch a movie with them and talk about it. Read a book with them. Read the Bible with them. Do things that, write. You know what's a really great thing? I'll end with this. Pick out one person in the next couple of days that you haven't talked to in a little while and write them an email. Just write them an email. Hey, Uncle Philip, I haven't seen you in such a long time. I was just wondering how you. Write Uncle Philip. Write your sister. Write somebody a letter and send it. You have time now. Take the opportunity.
Just make sure you spray Lysol all over the letter. Wipe it down.
Yeah.
Then put it out there.
Open it up for 5 days at least.
Oh, man. Well,
Black Rodney again.
No, this has been great. My big concern is right now the people who live in areas where they don't have the same resources that most of us have, and there's many people living in the same home. And it's hard to, you got 14 people in a 2-3 bedroom house. You're going to start to get on each other's nerves. There's going to be fights, like we said, domestic violence. You got the teenager just like, whatever. And he's going to walk out with the basketball, touching everything as he gets to the, you know what I mean? It's like, this is crazy. So my call to action would be, let's have compassion and empathy for people, because as my favorite book says very clearly, my people perish for the lack of knowledge. And when it comes to all of this, I think it comes down to education. So like you said, John, we got to get people educated. And that's what this program is all about, is helping people get educated with the goal of getting healthy, being healthy, and staying healthy. Thanks a lot, you guys.
Boom. Boom.
We're out of here.
Thank you, guys.
Bye, you guys.
Thank you. Thanks, John. Thanks, Babs.
Thanks, Do Money.
Bye-bye.
Bye.